welcome to some of you Eastsiders. I'm glad that y'all are here. We sent out the invitation to our founding members, so I'm glad to see all the groups coming together. And moving forward, we're going to be doing this as an Alley Upstate family. So welcome to everybody, and thank you for attending. And for those of you from Spruce MD, we're glad to have you here. Dr. Shiffman is going to present on preventing dementia, and I won't spend too much time. I'll give her the floor, but she is a physician at Spruce MD and is going to impart her knowledge on us. And we are very excited, as we can tell by the attendance, and I know you are too. So take it away, Dr. Shiffman.
Thank you so much for all being here. And I've been joking, it's such a nice day, so I really appreciate that you didn't no-show and fail on this nice sunny day. So I'm Jeanne Shiffman. I'm a family doctor and integrative doctor. I work right over there at Spruce MD. And so I'm happy to be here because I learned a lot myself preparing to give this talk. And I'll have some handouts. I'm gonna wait towards the end. Now I can't see a time here. Whitney, do you have a watch on? Can you maybe give me like a 20-minute, so I make sure that I'm trying to get these out and go over these?
Of course.
Okay, perfect. Here we go. All right. So what is dementia? It's a broad term. It's not real specific. It's memory loss. It's cognitive. Your thinking ability is impaired, and it's really affecting your day-to-day life. Okay, so here's the main forms: Alzheimer's, vascular, like strokes, mixed. So you can have both, unfortunately, and other. Okay, and we'll get into all of this. Alzheimer's. Okay, so what is Alzheimer's really? Alzheimer's is when neuronal, meaning nerve, degeneration and atrophy, like decaying, shrinking in the brain, and it ultimately can lead to death. You may have heard about the plaques, amyloid plaques. Their real name is beta amyloid plaques, so like the sticky plaques that you're seeing around the neurons, around the nerves when they've done autopsies. Okay, and there's also tangles. Tall protein tangles can be found inside the nerves. So Alzheimer's, well, the primary risk factor is age, unfortunately. Your risk doubles every 10 years once you hit 60. And most of the cases, 85% or so, are in people 75 and older. And there is a thing called young onset dementia that is starting before age 65. Okay, so I know 66 also seems really young to have Alzheimer's, but technically the clinical definition is below 65. All right, so some risks. So genetics is one of the risk factors, okay? If you have a parent with a dementia, you have twice the risk of getting dementia, okay? But the older your parent is when they're diagnosed, then sort of the less risky it is for you, all right? And if your parent was actually diagnosed over the age of 80, like at 82 or something, then there really is no risk compared to just an average person, okay? Big genetic risk factor is this thing called apolipoprotein E, okay? Often just called ApoE, okay? So this is a gene. It can have there's different forms of the genes that you can inherit. With genes, we get like a gene from mom, right, and a gene from dad, okay? And so this ApoE variants are 2s, 3s, and 4s. And the 4s are considered the risky kind, okay? So and the people who get a double 4 from mom and a 4 from dad, are in the highest risk of getting Alzheimer's. Vascular dementia. So unlike Alzheimer's, which is a disease, it's like they can see what it is on autopsy, it can lead to death. This is just more like a syndrome encompassing a lot of different things, okay? It can be cerebrovascular, which is more like a stroke, cardiovascular can cause it, like heart disease, but it's things that are leading to brain injury, vascular brain injury, which means your blood vessels in the brain, okay? And we've seen in people stroke, their first stroke, about 10% of those people are going to develop dementia, like new for them, dementia. And if you're getting a second stroke, then your risk is going up even higher, up to a third. So, with strokes, you're having a decrease like oxygen and sugar in the brain. It's sort of dying off. So it kind of is obvious, I guess, right, that your brain's not getting everything it needs and it's dying off. It's going to affect your memory. Okay, so there's been a lot of research lately, which is really exciting, about dementia, and in some ways it's a mixed blessing, because you kind of read a headline and you're like, oh, should I do that? Oh, what about that? It can almost be overwhelming or contradictory even. So I tried to find, really big studies, with lots of numbers, and that seem stronger than some of the one-off things. So in 2020, The Lancet, which is this well-known British medical journal, had a commission, and the commission was on dementia prevention, intervention, and care. And anybody can look this up, okay, on the internet if you want to see about other things, like where they're talking about care of somebody, with dementia. There were over 28 authors from several countries, including our own country. So this large commission of people, they're looking at all the different studies and the data around the world, okay, and saying, how can we prevent dementia? What can we do about it to make it better? And they're saying, this is their quote, "It is never too early and never too late in the life course for dementia prevention." So that's nice, that's encouraging. And they're saying at least 40% is preventable. Okay, so this is kind of a cool picture I got from the Lancet Commission's report. And I don't know if you can see it, I'll kind of talk through it a little bit. They're talking about the various risk factors, and up here you have early life, midlife, and later life. They're saying risk, and that these are about 40% of the things you can do to help not get dementia, and that 60% is unknown. I would say the genetic part is part of that 60%. I'm not saying it's the whole part, but the commission was more focused on what people can do, and I guess the thought is, well, you can't change your genes, so they weren't focusing on that. And even beyond this slide, I'm going to talk about more some of these individual things, but education, okay, that's why they're saying earlier in life, how much education are you getting? And then midlife, they're talking about hearing, injuries, blood pressure, drinking, weight, some of these things that are midlife and later life, they're overlapping. I think they're true for both, age groups. Smoking, your mood, your activity, diabetes, and even pollution, small. So so the bigger the circle, kind of the more important it is. And I found it really interesting how important hearing loss was. I know that surprises you, but you would think like, I don't know, diabetes or something, would be bigger. And it is amazing how prominent the hearing is, and I'll touch on that again. So here's another really big study. So the UK Biobank, and this just came out recently. So when you have national health care, like they do in the UK, they can keep all these records, right? And then they can just do these studies on so many people, right? So it's over 350,000 people in the UK. And they were looking at early dementia. So early dementia is that under 65, but I still felt like it was worthwhile talking about, because in a sense that's like the worst kind of dementia, right? So it's like, well, what are they seeing as happening? And they really looked at, I think, like 39 different factors, and they just said, okay, these are the ones that actually mattered the most for early dementia. So there's definitely overlap, okay? So here's some of the things that were the same, that lower education, the hearing again, alcohol, the mood things, and the blood sugar. Okay, but they had some additional risk factors as well. here, you're seeing the genetic thing, okay, that the Lancet's not really addressing, that ApoE, people have 4 from mom, 4 from dad variants, stroke, heart disease. Here's some labs, which are kind of interesting, and things you know we can really do about, like your vitamin D. CRP stands for C-reactive protein, so I have a slide on that. Okay, we'll talk about that later. Lower hand grip strength. You're like, huh? What? So it was just, it's an easy way to check your overall strength. Okay, right? So they didn't have time in UK clinics to put everyone on a treadmill or whatever, right? But you can kind of say, you know, squeeze my hand really hard and you can see, and it's just considered reflective of your overall strength. Interestingly, no alcohol use. Okay, so in the Lancet we saw too much. The UK Biobank also saw too much, but they're also saying none. And orthostatic hypotension. That means low blood pressure. People are probably kind of fainting easily, maybe a little unsteady. Hearing, okay, so this hearing again. Yeah, I was really amazed by how important hearing was. And so the thought is cognitive stimulation to the brain. I know some people said to me like, oh, well, maybe it's social, right? Maybe you're not interacting with people. You know, that might be true. Also, interestingly, not seeing a connection to vision. Okay, that we're just seeing a hearing connection with dementia. And they have done studies where they've had long follow-ups times, okay? And it does seem that wearing the hearing aids is protective, okay? So the good news is you can do something about it. You can get checked for your hearing and wear the hearing aids, and they're really nice and small nowadays. So I'd say don't be embarrassed, like it's really important. Okay, hypertension, high blood pressure. This is important. It's linked to things like stroke and heart disease, and we know that's important just in general, right, with the vascular type dementia. Here's a study where they were looking at high blood pressure from the age of 40 on, and they were seeing sort of reduced brain volume, so sort of shrinking, and the texture like changing. That's that white matter hyperintensity. So they're not seeing amyloid deposition. That means they're not seeing the plaque buildup. Okay, so high blood pressure is not causing more plaque, all right, but it is maybe kind of shrinking your brain, the stress on the brain. You want your blood pressure, that top number, you get 2 numbers, that systolic blood pressure to be 130 or less, even if you have to take medication. And in fact, the study, I believe this is from the Lancet, here's their quote: antihypertensive treatment for hypertension is the only known effective preventative medication drug, okay, for dementia. So people are like, I don't want it, so maybe you all are here, so I know you're amazing. But say you have somebody in your life who's like, leave me alone, I don't want to do stuff, just give me a pill for it. Blood pressure. I'd say blood pressure and hearing aids. And, if you could talk them into those 2 things, right? If they're grumpy and don't want to do anything. Those are 2 important things to do. And it doesn't seem to matter the type of blood pressure pill, okay? It's not like it's got to be, diuretic or not a diuretic or whatever, okay? It's really more about getting that number down, okay? So you're not shrinking your brain. Diabetes. So diabetes seems to be a risk for both the vascular dementia and for Alzheimer's. And found this mention here where they were saying even people with higher glucose levels and not to the point of diabetes, that might be affecting your cognition and memory, insulin resistance. In fact, I just yesterday saw something about women with PCOS. If you've ever heard of that, that's some women have irregular periods and a thing called polycystic ovarian syndrome, PCOS. And a lot of times with PCOS, we see insulin resistance. Okay, so that was kind of confirming this, that it's something to work on. obesity. Okay, so obesity is a little complicated because there's so much overlap in just being, quite overweight with other diseases, right? So a lot of times we see there's blood pressure issue or diabetes. There's a lot of, overlap. But several studies have shown that being obese in midlife does increase your risk of dementia, but not all the studies. And in the Lancet, it was there, but it was not one of the highest. So I think we all want to be slim, but I don't want to stress people out about either. Okay, education. Okay, so this is kind of interesting. This is like up at that chart at the beginning when they were saying early in life, all right, the importance of education. So the Lancet Commission is defining, lesser education as not finishing high school. Okay, so I don't want anyone to stress out, be like, I knew I should have finished my degree, I never got around to it, it's his fault, Okay, so just have to finish high school, all right? But this is kind of an issue, though, can be all around the world, right? They're looking all around the world, and unfortunately, a lot of people don't have the opportunity to finish high school. And more education is good, okay? So if you're more than that, great, because there's this thought that you're building more networks in the brain, there's redundancy. So it's not that being more educated, again, it's reducing your plaque buildup, okay? It doesn't do that. But you just got more like wires, channels, okay, networks in your brain. There's just more to access there. And this is called cognitive reserve. You have more reserve, okay, the more education you have.
Can I ask a question about that? So is that just in relation to academic education or lifelong education, or was there any reference to that?
Yeah, I mean, when the Lancet, they're specifically talking about formal education that people, have gone all the way through. But there does seem to be some, yes, formal education, the more you get, the better. I think it's really hard for studies to distinguish, like, well, they didn't do that much education, but they've always been in really good book clubs, and did all this other stuff. That's really hard to measure. Yeah. But I would say it seems logical, right? Because a lot of this is, hey, if you and your 3 friends read Shakespeare and talk about it, that's good, right? How is that so different than doing it in a class, right? Depression. Okay, depression is also a risk factor in these big studies. A meta-analysis. Meta-analysis means they're looking at, it's a study of a lot of studies, okay? Showing that late life depression is associated with increase in all kinds of dementia. Just pointing out here, though, unfortunately, in early Alzheimer's, we a lot of times see depression. Okay, so sometimes it's just a warning sign of the Alzheimer's coming on. But did find this study, this Australian study. So they pretty good amount of people in it, and these people had mild cognitive impairment. Okay, so that's like a precursor to dementia, right? It's like your memory's not great, but you're not kind of really at that true dementia stage or really diagnosed yet with Alzheimer's or something like that. So in that group, they were treated with an SSRI. SSRI is a selective serotonin reuptake inhibitor, which is the most common form of antidepressant. So it's the Prozac, it's the Lexapro, it's the Zoloft, okay, it's all the ones you, or probably people you love, take, because they're very commonly prescribed. And so for people who were on those medications for more than 4 years, we're seeing less dementia or a delayed progression into the mild impairment turning into dementia. Okay, so it seems that there's something you can do about it, and then like, hey, cheer up, like you can, some medicine might help. Alcohol. Okay, always repeated, right? What's she gonna say about this? It's Friday. Come on, girl. All right, so here was a big study done in the younger side. Okay, so drinking more than 21 units is increased with dementia and is long-term abstinence. And also just drinking more than 14 units or drinks per week, they were seeing sort of atrophy in the brain. The long-term abstinence thing is kind of interesting, and people kind of speculate about that. I think what's happening is, you know, it's a mixed group of people, okay? You know, there are some people who don't drink at all because they're ill, all right? There's some people who don't drink at all because they have alcoholism, right? So it's not necessarily people who are maybe doing it for religious reasons. You know, you have a big mixed group on that. So I think it always sort of have a little, I don't know, you know, it's kind of like, I should go drink, it's good for me. Like, yeah, it's hard to say that. You know, I wouldn't necessarily say that from the studies, okay? I know the studies are saying, like, you know, people who didn't drink at all had more, you know, more dementia, but why are they not drinking, okay? And this also sounds pretty good, like 13 drinks a week, like, hey, that's, I'm allowed to have 13 drinks a week. There's other reasons to, you know, be moderate with alcohol, like cancer, okay? That's another talk, but I'm just focusing on dementia today, but yeah, I'm not authorizing you to drink 13 drinks a week. All right, traumatic brain injury. Okay, so mild traumatic brain injury is a concussion. And severe is real, you know, big injuries, like there's a skull fracture and the brain is swelling and bleeding and things like that. So remember when we were first talking about types of dementia, there was sort of this other category. This is part of this other category. Traumatic brain injury is associated with things like Parkinsonism, Lewy body disease, repeated head trauma from sports, like especially a lot of those studies are done in the UK, like we say soccer and they call it football, right? Like guys like heading over and over again, can have this chronic traumatic encephalopathy. So maybe you've seen that in the news also, that some of our athletes causing problems. All right, here we are back to C-reactive protein in the labs. Okay, so remember in that biobank study of young onset, they were mentioning this being an issue. So this is a lab test. You can just do it, you know, at a regular local lab. And it's a marker for inflammation, okay? It can be acute inflammation, chronic, it's not specific. You know, when we get, if we see an elevated value, then we're like, hey, let's try and figure this out and try and get this inflammation down. There's one of the CRPs is labeled as CRP, cardiac, and again, it's not necessarily heart inflammation. It's just considered a little more, I don't know what the right word, specific or fine-tuned, like numbering of CRP. But yeah, this is just an inflammation. So inflammation is not great for you. Vitamin D, okay, also in the biobank. Yeah, so I found a couple studies. These were in women, but I would assume would be true for men. There doesn't seem to be a hormonal issue, testosterone or not, you know, with vitamin D. That if people were low in vitamin D, then their cognitive scores were lower, and if their vitamin D was better at the recommended levels, then their cognitive scores were higher. That's a pretty easy thing to test and to do. Take it. Sleep. Okay, so sleep isn't really being talked about in those studies, but I do think it's really important. And we can see studies on that as well. So the thought is, you know, we're talking about building up these plaques, right, in the Alzheimer's. Then maybe one of the things sleep does for us is it kind of flushes it away. It's kind of clearing away this plaque buildup. So you need enough sleep time for this to happen. So here's a study done in Europe and on almost 8,000 people, so that's a really good amount of people. And they looked at people who were sleeping 6 hours or less at age 50, 60, and 70. Okay, and compared to the people that slept 7 hours, so they were saying normal was 7 and above, they had a 30% increase in dementia risk. Okay, so that's pretty significant, right? And then, you know, they followed these people, and the average age of dementia in this group was 77 years old. Obstructive sleep apnea, okay, often seen with like snoring. This has also been associated with increased risks of MCI, that's that mild cognitive impairment, and dementia. And then hypnotics, okay, so sleeping pills, all right? And it says here, such as benzodiazepines, that's the things like Klonopin and Xanax. Sometimes people take these Valium, okay, sometimes people take these things for sleep. That is also a risk factor for dementia. So unfortunately, that's not necessarily a great solution if you're saying, well, I'm not sleeping enough, I'm trying to get to 7 hours. Don't take these pills because you're not really benefiting yourself. Infection. This I think is cool, my cool geeky way, because I feel like this is like some of the newer stuff, okay? I think everyone's like, blood pressure, yeah, okay, whatever. But this is kind of more newer thoughts in medicine. So Alzheimer's patients in general seem to be showing signs of inflammation, there's that inflammation again, and nerve degeneration consistent with bacterial infections, okay? I guess when they're doing autopsies, it's sort of looking that way. They're also finding in the plaque microorganisms, okay? They're finding bacteria in the plaque. And one of the thoughts is the plaque is building up because it's trying to fight off or protect the brain from these infections. And there's a study of people's severe sepsis. So that's like severe infection, like it's in your blood, you're kind of sick all over, okay? People were hospitalized. They had an increased risk of dementia, okay, compared to people who were hospitalized for other things, not sepsis. Okay, so talking about infections, so herpes in particular has been linked, has been found in the brain plaques, okay? And it says particularly HSV1. Okay, so that HSV1 is herpes, like it tends to be more like the upper herpes, like cold sores, okay? And HSV2 is more the genital outbreaks. Okay, so we're talking more about the upper stuff. ApoE4, remember we were talking about that, that's the genetic risk. Those folks are more likely to get cold sores, interestingly, from the HSV1. So if you're a type of person or you know somebody with a lot of cold sores, maybe they should get checked for the ApoE. Varicella, which is chickenpox when you're a little kid and shingles when you're older, is also in the herpes family. Okay, so also included as a possible risk with dementia. In fact, there were 2 studies where there seemed to be small risk, but some risk of Alzheimer's, okay? People getting shingles. But if you were getting treated, then that was not the case. Okay, so if you get shingles, don't suffer. Get the antiviral medication, okay? It might help you feel a little better in the short term, and also help prevent getting dementia. And yeah.
Get it once you've already got it, the shingles vaccine after you've had shingles, like is there, like can you get shingles again?
Yes.
Okay, so it's okay to get the vaccine if you've had the shingles.
It is,
My dad
yeah.
had shingles last year. So.
Oh, yeah, you can. Yeah. Yeah, and we can check, sometimes people aren't sure, we can check antibody levels in the blood. Dental health, okay, this can be another type of infection. This particular one, P, very long name, I don't remember. Gingivalis is a bacteria linked to gum disease, has also been seen in the plaques in the brain. And here's the fun word of the day, edentulosum, which means having fewer than 10 teeth, has been a predictor of dementia later in life. Okay, so your mouth health is also really important, okay, for helping your brain. It's right there. So this last one there's this nun study that's been going on for a while, which is pretty cool. This order of nuns, the sisters, I'm not sure if it's Notre Dame or Notre Dame, I don't know if they're pronouncing it, American or French. But this order agreed to work with researchers. This order is, they tend to be educators and run schools, so they felt like this was a good part of their mission to also help in science. And so it's nice because it's so controlled, like they're all eating the same things, they're not out partying at night, it's like all very controlled. And then they kind of follow them and like they can look back at some of their early records, and they've even done autopsies on them. So really tracking what is happening over their lifetime with their cognition, and the teeth thing is from that study. Gut health, okay, another thing that can be on the infection side, maybe other things we're still trying to understand. So inflammatory bowel disease, there is a risk, okay, of dementia with that. Inflammatory bowel disease is kind of is more serious digestive diseases like Crohn's and ulcerative colitis, okay? So not IBS, okay, not just kind of feeling that people with the real diagnosis of Crohn's and ulcerative colitis. They have found that folks who are constipated, which means you're not having a bowel movement every day or every other day, okay? It's less frequent than that, like you're going every 3 or 4 days. Are kind of aging, their brain is aging faster, okay? Compared to those who are having a daily bowel movement. And there also seems to be a little bit of a risk, increased risk of cognitive decline in those having more than 2 bowel movements a day, okay? Kind of suggesting just having your gut not be maybe as healthy as it could be, can be a risk. So the microbiome, which is another kind of cool hip topic in medicine that people are looking into, researchers have looked at the microbiome, okay, of folks who have dementia at very specific strains. And they are seeing lower levels of these, which I will not try to pronounce, and higher levels of these other ones. And we can test these, okay? There is advanced stool testing. This isn't done through normal labs, but we do it actually at Spruce MD. You can do advanced testing and you can kind of see what is in your gut and try and improve your gut health. And if you're trying to do everything you can, you've done your hearing, you're like, what more can I do? You do this. Hormone therapy. So this is sometimes comes up and can be, confusing, controversial. So the North American Menopause Society, that is kind of the national medical society dedicated to menopause. They are stating that it's really based on age. Okay, if you're starting hormone therapy within 5 years of your last period, it seems to help. Okay, it can be beneficial, but it may be harmful and cause dementia if you're beyond that, certainly over age 65. So this is kind of known as the timing hypothesis. Okay, and one of the thoughts is like, well, why is that? Is with all our hormones, we have receptors in the body. Okay, it's like these little loading docks that the hormones are floating around your blood, and then they link into the docks. If it's been a long time since the hormones gone into these docks, they're just gonna shrivel. Okay, they're just gonna go away, right? So if you're waiting 10 years after menopause, they're not there, and then the hormones are just floating around, and we don't know what they're doing. Okay, so that's kind of the general idea. Thyroid, real briefly, being hyperthyroid, and this is checked in the lab with a TSH, okay? And so a low TSH, like at or near 0, that's hyperthyroidism. that's a risk factor for dementia. And that could be true whether you have Graves' disease, which is causing your hypothyroidism, or you're just taking too much thyroid medicine. Okay, so I'd say you might be on thyroid medicine or know people. It's a very common medication, and make sure they're not getting in the hyper range. Exercise, yes, we're here at Alloy. We made it. It's very important. It's important for your overall health, right? Your cardiovascular health, your glucose control. Like we're talking about these other things. We're talking about vascular dementia and diabetes. Grip strength, right? We're saying that's a sign of overall strength. You want to be strong. Here's a big study called the Hunt Study, over 28,000 people, ages 30 to 60, and they showed that folks who at least weekly worked out, vigorously enough that they broke a sweat, that they had reduced dementia over a 25-year period. Okay, so they followed them for 25 years, which is great, right? That they were able to keep track of all these people and show that it makes a difference. It makes a difference. And the Nun study, which I mentioned earlier, also showed exercise is really important to preventing dementia. Diet. What about diet? The Mediterranean diet. Okay, that is the one that seems to have the best proof with it. It is good if you're general cardiovascular health. There was this trial that they had some people sign the Mediterranean diet, other people not, and it, had better cognitive scores. And the Mediterranean diet, that's not the point of this talk, but there's a lot of potential ways to look at that. We have a great dietitian in our clinic that can help people. And I just say that because I know sometimes I kind of wish the Mediterranean diet was pizza and gelato and red wine. Like, it's from Italy, so Mediterranean. But that's not really what it is, right? It's a lot of plants, beans, some fish, olive oil, kind of like you lived in a prosperous Greek village 100 years ago. Okay, that's the kind of diet it is. I also found the Nurses' Health Study, which is a big study going on in the US.
I've been in that for 45 years.
Yay!
And my kids are in it.
That's so cool.
Yeah.
The berries, okay, which are giving you flavonoids, so blueberries, strawberries, also very helpful. So that's nice. They're yummy. Oils, fish oil. Yeah, the fish oil, it's not clear if it helps. Okay, I don't think it's necessarily harmful for most people. You have to know your particular situation. It may be more, I read that it may be more of a benefit if you are the person with the ApoE4, okay? It's kind of something you can do. Olive oil, this is part of the Mediterranean diet, but there was a study this summer showing that those who had half a tablespoon of olive oil or more had less risk of dying from dementia, okay, compared to people who didn't really use olive oil at all. This isn't necessarily, I think, as strong a study as some of these earlier ones we're talking about. We're saying, really big numbers of people for a long time, but olive oil's nice, and there's not really a downside to using more olive oil in your cooking. Keeping your brain active. So just working your brain, right? Using your brain. So here's a smaller study, 205 people, 30 to 64. They followed them up for a long time, which is great, okay? They followed them up for over 30 years. That I kind of underlined here, and I guess this kind of goes back to the issue of like, well, does it have to be school, or what? So this is kind of saying no, right? Because travel, social outings, right? Social isolation was a risk. Playing music, art, physical activity, the exercise, reading, and speaking a second language. Okay, so all these things were helpful for your brain. And this was independent of education. Okay, so didn't really matter how much schooling you had had, or what your job was, and even kind of, they were saying some structural brain health. Maybe they were doing some CTs or MRIs or something on these people. So all that stuff is helpful. And in the nun study, one branch of the nun study, they found that people who are sort of better writers, okay, I guess these nuns wrote essays, even when they were like young women, like coming into the order, they would write an essay, and some might continue to write. They found that was even the better writers, that was even more helpful than multilingualism. So, yeah, I think, what do you like to do? Kind of maybe, find out what's your thing. Don't feel bad that you are not bilingual. A lot of Americans are not, right? But there's other things you can do too. Okay, that's it. Now, so I've got handouts, and it's kind of a summary, but trying to make it easy for folks to go over it. Yeah. Some of these out.
Jolson?
You're welcome. Anybody else?
How are we doing on time? What's that?
3:42.
3:42. Oh, it's 3:20. Oh, yeah, got plenty of time. Okay. Okay, so this is, repeating what I've already talked about, but, I just wanted this to be kind of like a little easier for folks to take with them, and we can also kind of ask questions, dialogue, about any specific things. I'm like, how would I do that? Or, so the ApoE, okay, so that's what I mentioned, that ApoE genetic thing. This can be checked in blood, okay? So regular labs, the regular major labs can do it. You can also online find a way to do a DNA cheek swab and mail it, and get it through the mail. If you have, this variant, I know that can sound pretty scary, okay? It doesn't ultimately mean that you absolutely are getting Alzheimer's, okay? If you have a 4 variant or even 4 and double 4, okay? It doesn't work that way. Even, in fact, in the nun study, there was a nun who was, elderly and never showed signs of dementia and was ApoE4, and they did her autopsy, and she had the plaques, but she didn't have dementia, right? Because dementia is really like how your memory seems, right? How you seem and live, okay? So yes, you are higher risk, but I don't want it to feel like a horrible sentence if you do this test and get this. There is a website, apoe4.info, which was started by people with this, okay? And so it's kind of cool. They're sharing all this info, and here's the latest study, what brand of olive oil do you use, just trying to really get specific about, what to do. Vitamin D, okay, that's easy to check in regular labs. The normal range is between 30 and 100. C-reactive protein, CRP, that's the inflammation test. You want to have, it's just the lower the better. Okay, so normally the lab will say something like 0 to 3 is normal. And then we can check herpes antibodies. particular, if you know you have the APO before, and you're trying to do everything you can. Hearing, we talked about this, it's important, get checked, seems that there's any issues, wear the hearing aids. Same with blood pressure, get checked, get the numbers down, doesn't seem to matter, and what particular medicine. Cardiovascular, okay, so don't smoke, that was officially there on the one of the studies, I can't remember if it was Lancet or Biobank, maybe both. Yeah, I mean, with cholesterol, if you're getting some labs, you have high cholesterol, you can look for plaque. Like, do I have a risk? What's my real risk for heart disease? You can get a CT, coronary calcium score done. You can also get an ultrasound of your carotid arteries, look for plaque. I would say a lot of times HDL is, we call it like the good cholesterol. Very high LDL is actually a risk factor for dementia, unfortunately. So there is kind of a limit on, and I'm sorry, I don't know like what that specific number is. Like, what is it? It's 80? No, but you don't want to have super high LDL. That seems not be great.
HDL, right?
HDL, yeah, sorry. Blood sugar, right? So that was listed that you want to have as possible normalized blood sugar and treating obesity. Now, a lot of people nowadays are on or looking into or interested in the medications, the injectables, like Ozempic and Mounjaro. We don't know. Those haven't been out long enough, so I just can't say if that would help with dementia. Diet, okay, I think we talked about that. Exercise, it's good in general, right, for helping things like your blood pressure, blood sugar, and strength training is important. Mood, remember it said, that the people were getting treated for depression, that seemed helpful. Social isolation is mentioned, right? So being active, doing things with others. This gym is great because they're doing cardio and they're doing muscle training in a group setting. That's great. Like, you're checking off so many things here at this one gym. Infections, dental care, floss. Okay, floss every day. Take really good care of your teeth. If you're getting outbreaks of herpes infections, shingles, take medicine. There was an interesting thing about vaccinations in general might be protective, like the flu shot. It didn't mention COVID. COVID's new. Okay, so that's not, like, nobody can tell about COVID and dementia. But with this idea of our infections, part of this cause of Alzheimer's, that reducing your risk of infection. Women, there's the hormone therapy, might be helpful, but don't wait too late. Sleep, getting sleep. If you have the sleep apnea, using a CPAP machine to rectify that. Avoid. So benzodiazepines, I mentioned that in the slides. That's the thing, like the Valium, Xanax. Also Benadryl. Okay, that's also not great for your brain long term. Okay, you're taking it for like 2 days on a trip. Fine. Okay, don't panic. But like using it regularly, like Tylenol PM or Advil PM. That PM usually is diphenhydramine, okay, which is Benadryl. Okay, that's not good for your brain. Gut health, you want to have 1 to 2 bowel movements a day. I work a lot on gut health with my patients. In our practice we do. You can do more advanced testing if you're curious about that. Mental activity, keeping active, can be a variety of things. Things that might help. So the olive oil, that came up. I've had like 2 studies about like 100 people in China. So it might, that's why I put it might help. Like it might help, might not be harmful, but there's kind of buzz about it, and it's a maybe. And then here's a good book to read about aging, and not necessarily just dementia, but just in general, kind of being your best as you age. And we have our office email down there, so if you have a follow-up question, you can shoot me an email, they'll pass it on to me. Okay. But I'm happy to take questions now. Thank you. Thanks for your attention.
Dr. Shiffman, have you heard anything about, it seems like I think it was, some people in blue zones that they had studied that had shown that they had plaques, but there was some other protective thing in the brain or something because they did not show signs of dementia. Are you familiar with that?
Yeah, I mean, that's something, they were seeing that in the Nun study too. That it's not totally clear, like, what's up with these plaques, right? Like, is the plaque the problem? Is the plaque the brain trying to protect itself from infections? There's something with the plaque though, because one thing I read was there were a small group of people in the UK, not recently, earlier years, like mid-20th century, who got growth hormone. Okay, like these were people with a short stature, okay? And they were given growth hormones to get taller. So they were given it as kids. And they were getting the growth hormone from cadavers. Okay, nowadays they make synthetic. That's what I'm saying. It's not happening now. I'm like, oh my god, my nephew got that. You're like, okay. But over, mid-20th century, they were given cadavers, okay? And it turns out that a number of these people who got that growth hormone were getting really early dementia, like at 35 or 40, and they traced it back, and they think the cadavers had like the plaque and the prion, and it's all part of like the mad cow thing that happened in the UK, and that it was transferable. So it was like this infection that gets transferred. So yeah, it's interesting, and we don't know all the answers. Like pharmaceutical companies have spent a lot of time and like millions of dollars in creating drugs to just decrease the plaque. Right? They're like, hey, we did it, we decreased the plaque, and then people's dementias are not getting better. Okay, from these medicines. So why not? Right? So it's just unfortunately more complicated than, plaque bad, get rid of the plaque.
But could you surmise that if there are fewer plaques, that there might be less infection to protect from, and therefore that brain is in better shape? More related to the infection than the plaque, which is a symptom of the infection, or a reaction to the infection, maybe.
Yeah, I mean, could be.
Yeah. One other quick question. I have heard that, like a mental activity, that to keep trying to learn something different. Like if you have mastered Sudoku, move on. Go to connections, or just keep trying. Don't stay with the same crossword puzzle, or challenge. In other words, challenge yourself in different ways. Have you heard that as well?
Yeah, I agree. I think that's really good advice. That kind of, if you do crossword puzzles every day, well, you get good at crossword puzzles.
Yeah.
Right. So right, kind of newness, or almost, you're challenging yourself, right? It's a little bit hard. Like one of the things they think of being bilingual is you're not allowing yourself to just use your default native language, right? Like it's a little harder to think about what to say in another language, right? So doing things that are a little bit harder and different is good.
really great, language apps too these days.
Mhm.